Good morning, everyone. On behalf of the Bureau of Justice Assistance, it is my privilege to welcome you to the FY13 Grantee Orientation for the Justice and Mental Health Collaboration Program. Let me begin with a huge thank you to David Demora, the Director of National Initiatives for the Council of State Governments, and for his very dedicated staff who did such an outstanding job organizing this national meeting and pulling together some of the leading experts in the country on justice and mental health issues to share their wisdom and expertise with all of us. Thank you also to the national partners who are sponsoring today's event with BJA. Let's give them all a big round of applause. The most important reason I wanted to come here today, however, was to thank all of you, our 2013 grantees in person, for the critically important work that you are doing as part of our Justice and Mental Health Collaboration Program. You are the ones who are in our communities every day seeking solutions for one of the justice system's most challenging issues, the over-representation of persons with mental illness in our criminal justice system. And in seeking those solutions, you are saving lives, strengthening families, inspiring hope, and improving the administration of justice. You are using research and data to foster systems reforms and creating an ever-growing community of professionals to address these important issues in our nation. Thank you for all of that. I recently testified at a Senate Judiciary Committee subcommittee hearing on law enforcement responses to disabled Americans, promising approaches to protecting public safety. During the hearing, I was able to highlight much of the good work that you are doing under the Justice and Mental Health Collaboration Program, including your work in mental health courts, mental health and substance abuse treatment programs, reentry services, programs for persons with co-occurring illnesses, cross-training of criminal justice and mental health professionals, specialized police responses, and crisis intervention teams, CITs, among others. I emphasized in my testimony a theme that I believe reflects the central focus of the program here today and tomorrow. The fact that we know so much more now than ever before about what works in criminal justice and in improving the outcomes of justice-involved persons with mental illness. I also spoke about the focus of JMHCP on implementing evidence-based and promising programs and strategies, the importance of risk assessment and focusing our precious resources on targeting the right people for the right programs, themes which we will hear more about in the plenary sessions from preeminent experts in the field, Dr. Fred Osher and Dr. Sarah Desmarais, and the talented speakers in breakout sessions you will participate in tomorrow or today and tomorrow morning. I'm so pleased that the conference is including sessions on the Affordable Care Act, which offers many new opportunities that grantees can harness to increase and improve access to health care coverage for justice-involved individuals. As many of you know, in addition to improving access to health care by expanding Medicaid and the private marketplace options, the ACA provides a new requirement for health care insurers to include mental health and substance abuse treatment as essential health benefits and imposes parity protections that require coverage for mental health and substance use disorder services to be no more restrictive than coverage provided for substantially all medical and surgical services. That is so critical to the individuals you serve in your programs. We know that until now, an estimated 70 to 90% of persons released from prisons and jails have not had access to health care coverage. We also know that for individuals re-entering communities after incarceration, disruptions in medical care and treatment contribute to increased rates of reincarceration, increased drug use, and poor and costly outcomes, including an unbelievable 12-fold increase in the risk of death in the first 2 weeks after release. State and local criminal justice can play an important role in ensuring that justice-involved persons receive assistance and support in applying for health coverage, as well as providing a continuum of care for individuals preparing to reenter their communities. And in order to further support your efforts in this area, BJA has adopted a policy permitting use of your grant funds to educate and assist participants in enrolling in health insurance programs, which can support their treatment and medication needs and promote continuity of care in the community. One other BJA resource I particularly want to mention is the National Center on Criminal Justice and Disability. Although BJA devotes a significant amount of resources and support in addressing the needs of persons with mental illness involved in the criminal justice system, we also recognize the need for the justice system to expand its focus and response to individuals with intellectual and developmental disabilities. In 2013, BJA awarded funds from its field-initiated program to the ARC to create the National Center on Criminal Justice and Disability, which is the first national effort of its kind to bring together both victim and suspect offender issues involving persons with intellectual or developmental disabilities. Once fully operational, the National Center will provide training and technical assistance and hopefully serve as a clearinghouse, an online resource for all of us in this important area. Last but not least, I want to thank the very dedicated team from BJA that supports the Justice Mental Health Collaboration Program. Please stand as I call your names. Policy Advisor Danica Binkley, Associate Deputy Director Ruby Kalzabash, and our BJA program staff who are here today to meet with you specifically if you have questions about your grants. Nikisha Love, Veronica Munson, and Division Chief Nadine Fulton-Jones. Please know that all of them and all of us at BJA are here to help you succeed with your grant programs. So if there is anything you need, please let us know. Thank you and welcome to the conference.